Hello and welcome to this edition of Bayou Time. We thank you so much for joining us. I'm your host, Keith Weisheit, licensed clinical social worker. And right now we are dealing with a number of changes. We're having to deal with how things around us are maybe not as good as they used to be. One of the people we love to bring in to be able to give us a little bit of direction and education, we bring in Earl Eues. Thank you for joining us through Skype, Earl. We're glad you have you with us.
Hey, Keith. Good to be with y'all today.
We appreciate it. Look, we're hearing lots of different things. We're getting different reports from different people. We know that things are changing a little bit. If you wouldn't mind, could you just kind of go over the last few days of what we're dealing with? I know these COVID numbers are going up. I just don't know exactly the right numbers and or what we're seeing it all over the parish.
Well, over the last few weeks, we have seen a large increase in the number of COVID cases. Just this week, not counting tomorrow's numbers, we've already had 688 cases, positive cases of COVID in the parish. Just last week, we had about 432 cases, and 3 weeks ago, it was about 240 cases. So we're seeing a significant increase each week with the COVID.
Yeah, and again, we see last week it was higher. This week it's even higher. And so not only are we seeing that with regards to the number of people that are coming down and having COVID, but we're also seeing that and hearing that our hospital systems are really starting to feel the impact of that. We got quite a few people that are hospitalized here now with COVID as well.
Yeah, just in Terrebonne Parish today, the COVID patient count is at 36. That includes 8 people in ICU, and we have 5 people on a vent. Over the last few weeks, we hadn't had anybody on a vent. So the Delta variant is a much COVID virus. And then we're seeing today 55 patients in the Lafourche area with 15 in the ICU and 7 on vents. So between the two parishes, we got 12 people on ventilators.
Yeah, and that's a huge number compared to where we've been over the last few months, especially with regards to the concern I know that we had early on with the number of people on ventilators. There was a big concern about them being able to come off of the ventilators, if memory serves me right.
Yeah, well, when COVID first started back, around March of 2020, we had a lot of people on ventilators, then the treatment got better, and the physicians were getting a better method of treating COVID, and we weren't putting people on ventilators as much. And then the last couple of months, we'd go weeks without anybody on a ventilator.
Yeah, and so now it's not only an impact here in Terrebonne and Lafourche Parish, but over across the state. I know the state itself is getting some national recognition, if you will, not something we really want to be nationally recognized for. But our state is got a high rate of COVID, got a high rate of those people in hospital systems, and a rather low rate of vaccinations.
Yeah, Keith, I think, and I didn't get any new numbers this week. I may get some tomorrow, but the cases had increased in the state of Louisiana per 100,000 residents, increased about 208% last week. Just here in Terrebonne Parish, the percent positivity came out yesterday. We went from 12.3 to 14.6. So that's a significant jump in the percent of positivity, which means that the majority of people who are getting tested are positive. But you have to remember that's only the people that's being tested. Some people have symptoms and are not getting tested, just self-quarantining themselves. So those numbers aren't included in those percentages.
So we're even though that percentage jumped up pretty high, we're seeing a large number of the people who are tested being positive, but there may be a whole lot more people who are staying at home, who are having to make sure that they're quarantining, and that may be a number of people that are also experiencing COVID.
Yeah, Keith, that could be asymptomatic. So if you're asymptomatic, you're really not sure if you're, if you're positive or not. The new nation is that if you have been around somebody that has tested positive with COVID, whether you are vaccinated or not, you should go get tested and then retest within 5 to 7 days after your initial test if you were negative.
Yeah, and so I just one of the things about being tested and in areas we are seeing lots of different places. Being in the medical field, hospitals, doctors' offices, assisted living facilities, we're just seeing a number of people that are having to go home and self-quarantine because they may have been in contact with somebody else. Are you seeing that kind of across the parish, and or we're being reports across the state?
Yeah, we are seeing that throughout the parish. We're also seeing people, even though they've been in contact with somebody with COVID, or knew somebody, over the weekend, or they visited somebody, they're actually not going to get tested because they don't want to quarantine. So, but not the right thing to do. If you have been in contact with somebody with COVID that is positive, you definitely need to go get a test so that you do not spread it to anyone else.
Yeah, and as we close out this segment here, it's important to know or to realize that because of this Delta variant, whether you've been vaccinated or not, if you've had exposure to somebody with COVID, you know that you should go and get tested to see where things are, correct?
That is correct, Keith. And there's many places that you can get tested. I was at a major drugstore chain this afternoon and noticed that they were giving free COVID tests within that drugstore and that pharmacy. So if you have any of the symptoms, please go get tested. And if you're positive, please stay home and quarantine yourself.
Look, I know we're dealing with a number of things. I have been being out in the field is one of those things that I do, calling on hospitals, and I've gotten some misinformation, I think, about the number of people that are in the hospitals and or the people that are being hospitalized with COVID. And it seems like we've got a lot of people that are in the hospital. I know we got a chance to talk about that, but let's talk a little bit about the number of people that are being hospitalized and if those are people that have been vaccinated or not.
So, Keith, at the present time, what we're hearing from the health officials is that 97% of the patients hospitalized in the hospitals do not have the vaccination or not vaccinated. That is a tremendous piece of data that if you would hear that you would think it would make you want to go get vaccinated. I do want to tell people that even if you are vaccinated, you can catch the COVID. The efficacy rating of the vaccines are about 94%, 93%. So that means you have a 6 or 7% chance of catching COVID, even though you're vaccinated. But the issue is that you are less likely to get seriously ill or ill enough to have to be placed in the hospital, and it significantly decreases your chances of dying. So, right now the hospitals are full of COVID patients. They're full of other patients that don't have COVID, that have other illnesses. We're pretty much in a crisis throughout the state as far as the number of hospital beds that are available and the ICU beds that are available. And we have a tremendous shortage of staffing within the hospitals. Just this past Friday, Dr. Canner, the medical director for the Louisiana Department of Health, on his press conference mentioned that we have a lot of nurses that have left the profession, maybe temporarily until the COVID passes, until the pandemic is over. We've had a lot of nurses and medical professionals who were close to retirement, who took retirement early. And then we have some that completely left the medical profession and went and found another career because of the pandemic. So we're beginning to request additional staffing right now through the Governor's Office of Homeland Security and Emergency Preparedness for several hospitals in our area to help alleviate the staff shortages.
Yeah, and we were seeing some of the staffing shortages even before we saw these spikes in cases, and certainly before we saw these spikes in hospitalizations. And so now I can tell you there are a number of hospitals in our state that are on diversion. Anybody that comes in with COVID that needs to be treated, they have to divert to another area. That's a bad place to be for us in this area. We've got a couple of hospitals with whole floors that have only COVID patients on them. And then, as you had mentioned previously, earlier, we've got a number of patients that are on ventilators and taking up a number of those ICU beds in hospital settings.
That's correct. Now, I do want to reiterate to our viewers that if you have an emergency condition, please go to the hospital. Go to the emergency room and get treated. Do not go to the hospital thinking that they won't have a bed for you or a room. But if you have an emergency condition, please go to the emergency room at your nearest hospital, and they will manage your care through that emergency room.
Yeah, and they have a triage system, and so it's a really great point. We don't want to scare people into saying that you're not going to be able to get treatment, because you are going to be able to get treatment. They are going to find a place for you to get the help that you need. We're just talking about the importance of how it's impacting the healthcare system and a lot of these healthcare workers that have really experienced some stress that none of us were ever really prepared for starting last March.
Yeah, Keith, I just can't reiterate enough the importance of going and getting vaccinated. One is, you won't end up, you have a better chance of not ending up in the hospital. You have a better chance of maybe not dying from the COVID. You have a better chance of not spreading the COVID to a loved one, your mother, father, grandmother, grandfather. We're seeing the younger population getting infected with COVID. Just this past week, I had a couple of people in where I grew up. One's on a ventilator, two passed away. People that I know, but they were unvaccinated, and it just makes me wonder, if they were vaccinated, would they still be here today? If you're not going to do it for yourself, do it for the people that you love, so that they don't have to go through you being in the hospital and or dying from the COVID.
One of these things that I think people are getting a little confused by is about whether or not vaccinations work, whether or not the vaccination is preventing people from getting sicker and dying. And some of the numbers that you've shared with us is that approximately 97% of the people who are in a hospital setting right now in Terrebonne Parish are those people that are not vaccinated or unvaccinated. Is that correct?
That is correct. And that's not just Terrebonne Parish, that's statewide.
Statewide. Okay. Well, that's very helpful, because we know that there is a push and an impact for people to get vaccinated. And maybe if there's ever the most important reason, this is it, is that we're seeing a younger population who are sicker than maybe that younger population has been, and a higher percentage of those people that are unvaccinated. I'm hoping that this will give people more of a reason to decide to go and get vaccinated for those that haven't. We're still kind of behind the eight ball, if you will, in both Terrebonne Parish, in the state, and as a state, about people getting vaccinated, right?
Yeah, Keith, here in Terrebonne Parish, about 68% of the population between the ages of 50 and over 70 have been vaccinated. The lowest population is those between the ages of 18 and 30. That's our lowest numbers. We're averaging maybe about 10 or 12% of that population being vaccinated. So, with the numbers being, if I go to you and say, hey, look, you have a 97% chance of being in the hospital if you're not vaccinated, that should be enough proof for you to go get vaccinated.
Yeah, no matter what you think about the vaccinations or what you think about their efficacy rates, it's quite obvious that even those that are testing positive, because we have a pretty high positivity rate right now, even with that high positivity rate, we're seeing that the number of people that are in the hospital, the number of people that are on ventilators, are people that are unvaccinated. Again, it's another direct relationship, just like we saw with the decrease of the spread of the pandemic and COVID-19 when the vaccinations came out. We're seeing some direct relationships.
Yeah, and Keith, the vaccine's working. I mean, that's why, you're seeing most of the people that's unvaccinated in the hospital, because the vaccination is working for those that have received it. We've seen an uptick in the number of people getting vaccinated the last couple of weeks, which I'm happy to see. And I think that the reason is because there's so much media attention to this Delta variant and how much more contagious it is and how much larger of a viral load that you have once you contract the COVID Delta variant. And so I think people are going to get vaccinated. We see an increase in numbers. But we're still at 29.6% in Terrebonne Parish. That's only 30% of a population of about 112,000 people. So we still got about 75,000 people in our parish that needs to get vaccinated.
Yeah, and the best option here is just to, I've got several friends in the last couple of weeks, like you've said, those people that have been pretty against getting vaccinated, realizing that some of the people that are in the hospital and some of the people that are sick on a ventilator, and more importantly, like you mentioned, dying, the vaccination can help them. And again, like it was mentioned previously, it may not prevent you from catching COVID. It may not prevent you from catching this Delta variant, but it's got a very high rate of efficacy for you not getting that sick, not having to necessarily go in the hospital, and about a 93% chance of keeping you from getting very ill.
That is correct, Keith. And look, the vaccines are widely available at many places throughout Terrebonne Parish. You can contact your physician. Some of the physicians' offices have the vaccines now. You can make an appointment at Terrebonne General Medical Center. You can make an appointment at Oshner's, at Oshner-Chabert. Most of the major pharmacies have vaccines, and our local pharmacies also have the vaccine. So it's widely available for you to get if you choose to get vaccinated. Also, once again, testing is available throughout the parish at different areas. There's even the materials and the vaccine, the materials get tested and the vaccine is widely available for anyone who wishes to have it.
Yeah, and so again, there's lots of opportunities for people to really just take advantage of what's out there. It doesn't cost you anything. It's easy to go out and be able to do that. If you have questions, you can talk to your physician. If you have questions, there's a number that you can call to get those questions answered. But quite frankly, I don't know that there needs to be a question to be answered other than the fact that getting the vaccination at this point with the spread of this Delta variant could possibly save your life.
That is correct.
Yeah. Well, Earl, we always appreciate you being able to share the numbers. We appreciate you being able to be a leader, but more importantly, we appreciate the passion with which you do your job and help us get that information out to the public. We always appreciate your time here at HTV.
Thank you, Keith. And please go get vaccinated. If you're not vaccinated, you should wear a mask and practice social distancing as much as possible.
Yeah, we appreciate that, Earl. Always a good reminder. All right. Well, thank you again for joining us, Earl. We thank you for viewing us at home. One of those things we appreciate. And bottom line is, don't be part of the 97%. Go get vaccinated. All right. That'll do it for us for this edition of Bayou Time. Don't go anymore. More local programming when we continue.